Good afternoon. So welcome to Tuesday Reading Live. This is me, Vandana PS, joining you from Neethu's Academy. Okay, so how are you all? Did you all do additional materials today? Okay. So as usual, I'll give you a sample question from part B. But as per your request on the previous day, I'll give you additional 3 minutes for the preparation of this particular question. Okay, so yes, so total I'll give you 5 minutes to do the question, then we will discuss the answer. Okay, and after that, I'll give you part A material, then let's discuss about part A in detail. Clear? Okay, so here comes the question. Okay, so back to the question. Okay, so did you do the question, this particular question? How was it? Yes, Reba. Jisa, Clarina, good afternoon. Okay, so how was this question? So this question comes under the category, I can say it's from the third category, okay, so which is a memo. So what is a memo? Okay, so in third category we have three different types, which are emails, memo and notices. Okay, so this is from the third category, the second one, which are memos, memo. Okay, so the result of the study. So as from the previous class, okay, already I've told you we have 5 different steps to do this particular question in part B. Okay, so what is the first step? Okay, so what about the first step? Yes, read the question. Okay, the result of the study described in the memo may explain why. Then, what are the keywords from the question? So that is the second step. Underline the keywords from the question. Okay, so what are the keywords here? Any idea? What are your keywords from the question? Yes. Yes, Sobi, what are your keywords from the question? Yeah, okay. Yes, good afternoon. Yes. Okay, so what are the keywords? What are the keywords from the question? This is a memo, as I already informed. So what are your keywords from the question? So my keywords from the question, which are result, okay, then described and memo. So these are my keywords from the question. So those keywords will help you to understand the question clearly. Okay, then, so I understood this is from the third category, which are memo, and I'm reading for. So what are you reading for in the memo? Okay, so if the question is from the third category, then we are reading for the purpose. So suppose I'm sending a memo to someone because I have a purpose. Okay, so we are reading for the purpose. Clear? Then when you read a question, always connect with your options. Okay, so what is the first option here? So the result of the study described in the memo may explain why superior communication skills may protect women from dementia. Then second option, it is option B. So there is a small correction in this particular options. Okay, so first option is superior communication skills may protect women from dementia, and option B, female dementia sufferers have better verbal skills, and option C, then mild dementia in women can remain undiagnosed. So these are the options. Okay, so once again, option A, superior communication skills may protect women from dementia, and option B, female dementia sufferers have better verbal skills, and option C, mild dementia in women can remain undiagnosed. Okay, so did you get this answer to this particular question? Yes, Nijita, good afternoon dear. Okay, so then let's read the paragraph. Okay, so this is all about a memo, and memo to staff. Okay, so who is the receiver here? It is to the staff. Women and dementia. Please read this extract from a recent research paper. Then women's superior verbal skills could work against them when it comes to recognizing Alzheimer's disease. So from the first line, I can eliminate a particular option. Which option that I can eliminate? Okay, so from the first option, I'm going to eliminate option A. Superior communication skills may protect women from dementia. So here, very clearly mentioned, it is contradictory option or opposite option, which is work against them. Okay, so here it is working against them. Superior verbal skills could work against them when it comes to recognizing Alzheimer's. So let's eliminate option A, that is contradictory option or opposite option. Then rest of the lines. A new study looked at more than 1,300 men and women divided into 3 groups. One group comprised patients with amnestic mild cognitive impairment. The second group included patients with Alzheimer's dementia, and the final group included healthy controls. The researchers measured glucose metabolic rates with PT scans. Participants were then given immediate and delayed verbal recall test. Okay, so nothing, there is no connection with any of these options here. So I'm moving to the second para. Women with either no, mild or moderate problems performed better than men on the verbal memory test. See, very clearly mentioned here, it's all about the memory test, not verbal skills mentioned, verbal memory test mentioned, both are different. So that I can eliminate which option? Option B can be eliminated, which are female dementia sufferers have better verbal skills. Where they've mentioned about they have better verbal skills? Nothing mentioned. Okay, so the verbal memory test mentioned here, so that we can eliminate option B because not mentioned, not contradictory, but I can say it's not mentioned anywhere. Okay, so that through elimination method, whether you like it or not, my answer is option C. Mild dementia in women can remain undiagnosed. But my question is, where is it mentioned? Okay, so as you know, in part B, we have total 6 questions, and the 6 questions will be like multiple choice questions with 3 answer options, and you have a respected paragraph here. Okay, and the technique or the strategy which we are applying is that elimination method or elimination strategy. Okay, so what is important when you read a question, underline the keywords, understand the question. So the most important thing is understanding the question. Okay, then when you understand the question, always think about, okay, in which category the question falls under. If it is a manual, okay, that is from the second category. If it is a policy, again, that is from the second category. But here, this is a memo, which means it is from the third category. Okay, then what are you reading for in the memo? So we are reading for the purpose. Clear? Then let's read, either you can read the paragraph or the options, whatever it is, it's up to you. Okay, then eliminate your options and find out the answer. Clear? Okay, Riba, it's all about elimination method, and Nijida, Sobi, Riba, you got option C. Excellent, very good. That answer is option C. But my question is, where is it mentioned? So part B is all about paraphrasing. Okay, so what is paraphrasing? So paraphrasing, which means that exact meaning of this particular sentence will be there in the paragraph, but it will be entirely, the sentence structure will be entirely different. Okay, different sentence structure will be there, entirely different. Okay, so that's what I can say. Yeah, so where is it mentioned? Option C is mentioned in which paragraph? Any idea? Any idea, Riba, Nijida, Sobi? Where is it mentioned? This particular option, option C, is mentioned in which paragraph? Any idea? Okay, it is paraphrased here, which means the same meaning will be there, but entirely different sentence structure. So where is it mentioned? Very good, Sobi. Last paragraph. So I'll give you another clue. Okay, if you guys are reading or if you guys are doing the third category of question, okay, which we are reading for the purpose, and I can say always the last lines are important. I am not saying that okay, last lines will be the answer, but still the last lines will give you a lot of clue towards your answer. So here you will get that answer from the last lines. What is mentioned in the last line? See the first line of the last para. Okay, because verbal memory scores are used for diagnosing Alzheimer's. Some women may be further along in their disease before they are diagnosed. So that means it is tracing towards option C. Okay, yes. Okay, Nijida, very good. So this suggests the need to have an increased index of suspicion when evaluating women with memory problems. So answer is option C. Okay, always last lines are important. If it is an email, then memo or a notice, last lines are important. And if it is an email also, the subject line will give you a lot of clue. Okay, so most probably 95% I can say that subject line will be the answer, most probably. Okay, so that's all about part B. So that's that. So any doubts regarding this question? Okay, Nijida, women with either. Okay, Riba, suspicion. Okay, Maran, last paragraph. Very good. Okay, so that's all about part B. Part B is all about 6 questions and multiple choice questions with 3 answer options. You will have a definitive paragraph for that, so that you can read the question, underline the keywords, then find out which category of question is that and what are you reading for in that category. Okay, and which sentence is important or which sentences are important. Then you can read the options or the paragraph, then do elimination method, find out your answer. Clear? Okay, and what about the timing? I can say you guys can take maximum 10 to 12 minutes for the completion of part B, because remaining 33 minutes we should spend for part C. Okay, so that's all about part B. Yes, so today's topic is soft tissue injury for part A. Another new topic, So again, very small text mentioned. Okay. So how is the material? Okay, and I can say this text was very easy to read, right? To skim and scan, it was very easy. But the questions, yeah, it is average, right? What about the questions? Do you guys think that it was very tough or average or it was easy? Okay, Sobi. Okay, yeah, it's okay, dear. Okay. Yes, so what about the material? Okay, so let's do the material. So the first thing that we are going to today is we will read the material, we will do skim and scan, then we will move on to the further details. Okay, so before that, let me condense something regarding part A. So part A, only after the completion of part A material, they will provide you with part B and C. Okay, so this is a total 1 hour exam, yeah, 60-minute exam. So out of the 60 minutes, you guys can take maximum, yeah, of course, 15 minutes for the completion of part A, not more than that. Okay, 15 minutes, exactly 15 minutes. But the problem is that, okay, if you guys are not practicing it daily, then you will not be able to complete part A within 15 minutes. Okay, so what this I'm trying to say is that, what I'm trying to focus is that, please do additional materials daily. Otherwise, you will find it very difficult to do part A within 15 minutes. Okay, about the timing I'm saying, yeah. Okay, so time management is very important. So please do additional materials every day. Clear? Okay, so that's all about part A then. So we have 4 different texts in part A, that is text A, text B, text C and text D. As you can see here, each of the texts will be different from one another. Okay, and one of the texts will be a pictorial. Okay, a flow chart will be there, or like a chart, okay, table, yeah, will be there. So one of the texts will be a pictorial of something, maybe a diagram. Okay, yeah. Then another important thing is about the question, categories of question or the type of questions. Okay, and we have total 20 questions in part A. So how many questions? 20 questions. Okay, and these 20 questions, we should complete these 20 questions within 15 minutes, but we should read 4 different texts within the same time. Okay, so is that possible? Yes. Okay, how it is possible? Again, repeating the same thing, do additional materials every day. Yeah, so coming back to the questions, and yes, see, it is 1 to 7, out of this 20 questions, 1 to 7 set of questions that can be called. Okay. So 1 to 7 set of questions which can be called what? Match the following question. So here you don't have to find that exact answer for the question, but still just find out in which text the answer is from. Okay, you need to write that text, particular text. If it is from text A, you can write A. If it is from B, you can write B. So likewise, just mention the text. Okay, so don't write text A. Just write, if it is, for example, if it is A, then you can write A. Okay, clear? Yes, so coming back, yeah, so 1 to 7 match the following questions. Then the next set of questions, which are 18 to 14, that can be called short answer questions. So always answer to the questions. Okay, and in short answer questions, there will be a lot of careless mistakes. So please don't make any careless mistakes while you do short answer questions. Okay, so always answer to the question. Just read the question and just think about it properly. Okay, why that question is there, or what they need, which answer they require. So please answer to the question always. Okay, and the final category, which are 15 to 20, that can be called fill in the blanks. Okay, so find the missing word or missing words there from the sentence. Right? Yes. And the most important part is the strategy. So what strategy we are using here to complete part A? So the strategy that we are using here, that is skimming and scanning method. Okay, that is the only method which will help you to complete this particular part. So what is this skimming and scanning? Okay, a very typical 2 words. So skimming, which means fast reading. Okay, so only through doing this this materials regularly, you will be able to read the materials fastly. Okay, so skimming, which is important, plus scanning. Scanning, which means investigating, not investigating, searching for important words from each of the text. Okay, so how will you understand these words are important? Any clue for that? Yes. Okay, Riba. Average material, but questions are tough to understand. Yes. Absolutely. Okay. Okay, Riba, fast reading and searching important words. Okay, how will you understand that? Okay, when you read a particular text, okay, these words are important. Okay, so for that, we have a 13 keyword strategy. So what are they? So mark all the headings. Hi, Riba. Yes, Riba Lijo, good afternoon, dear. We have 13 keyword strategy. Okay, so what are the keywords? The first one is heading, then subheadings, then if it is mentioned, you can mark all the headings and all the subheadings. Then the third one, all the numbers. Okay, so numbers which I can say maybe, the numbers like in figures or in words, whatever it is, mark all the numbers. Okay, then all the signs and symbols. For example, percentage is a symbol. Okay, beta is a symbol. Okay, equal to is a sign. Greater than is a sign. So likewise, mark all the signs and symbols. Okay, then names. One of the important keyword, mark all the names. Maybe name of a person, name of a disease condition, name of a country, name of an equipment, device, machine, name of medicines, whatever names there, mark all the names. Okay, and sixth one, all the abbreviations. Very good. Yes. Okay, so yes, it is abbreviations. So abbreviation, which means short forms. For example, here you can see American Academy of Orthopedic Surgeons, which means AAOS. Clear? So that is an abbreviation. So likewise, you can mark all the abbreviations there. And the seventh one is mark all the italicized or bold words. Okay, italicized, which means look like slanting words, and bold letters. Okay, and the eighth one, the words that indicate time, which is very important. Okay, for example, I can say after is a word that indicate time. When, WHEN, when. Okay, then currently, presently, previously, during, now, before, after, early, delay. Okay, a lot of words that indicate time. So whenever you guys see a word that indicate time, please mark it. It will help you to do this short answer questions. Okay, then the ninth point is mark all the words which can be related with experiment related words. The word experiment itself, okay, observation, then the word experiment, observation, administration, okay, identification, ascertain, diagnosis, absorption. Okay, then the words that can be related with research materials or research topics. Okay, so the word itself, research, researcher, study, population, group, aspects, analysis. Okay, so a lot of words that can connect with research. Okay, then the first and last line of each and every paragraph. Okay, if it is paragraph, if there are some paragraphs, so please carefully read the first and last line of each and every paragraph. Okay, as well as all the bullet points. Okay, so that's that. I'm not asking you to mark all the first and last line of each and every paragraph, but still always be careful with the first and last line of each and every paragraph, as well as all the bullet points. Okay, so that's all about the 13 keyword strategy that we have. Clear? Okay. Okay, Riba, heading, subheading, numbers, signs and symbols, names, bracket, abbreviations, bracket, italicized letters and bold letters. Very good, dear. Words indicate time, words that indicate research, diagnosis. Okay. Yes, Riba Lijo, it is heading, subheading, signs and symbols, numbers, brackets, abbreviations, all the names, words indicate time, research, time, all bullet points, first and last line of the sentences, italicized and bold words. Okay, very good, yes. Okay, so now let's do skimming and scanning, which means fast reading plus underline these kind of words, important words. Okay, so text take. Soft tissue describes any tissue in the body that is not bone. However, when discussing soft tissue injuries, people are mainly referring to muscles. Okay, so these are like points here. So I'm marking all the points here. Muscles, These are responsible for creating force and movement by contracting and expanding. A range of tough fibers make up muscles. Then tendons. These consist of tough tissue that connects muscles to bones. They transmit strength from the muscles to the bones and joints. Then ligaments. These connect bones to other bones, providing stability. Okay, according to the American Academy of Orthopedic Surgeons, that is AAOS, common types of injuries include sprains, strains, contusions, tendinitis, then bursitis. Okay, so what do you mean by sprains? These involve the stretching or tearing of the ligaments. These commonly occur in the wrist, ankles and knees. Then strains, these refer to muscle or tendon damage, often occurring to the hamstring in the back of the leg. Then contusions, these are bruising those squashes muscle fibers underneath the skin without breaking the skin barrier. Then tendinitis, this is a continuous irritation or inflammation of a tendon, in a tendon. Okay, then bursitis, the bursae are small sacs between soft tissue and bones that cushion the shoulder, elbow, knee, hip and heel. So that's all about the first text, and these are all the keywords from the first text. Okay, so now we are moving to the second one, text B. Okay, so what about text B? Very small text. Soft tissue injuries are common in sports and exercise. However, they can also occur during everyday activities, accidents and workplace duties. Causes often involve the following. Trauma. So what do you mean by trauma? So that is sudden impact or forceful movements that can lead to soft tissue injury. This might occur due to a fall, a slip or a sharp change in direction. Then overuse. Repetitive movements or excessive strain on a particular muscle or joint. Overuse injuries are common in people who play sports. Okay, inadequate warm-up before physical activity can increase the risk of sporting injuries. Then overloading. A sudden increase in exercise intensity can lead to a soft tissue injury, according to the United Kingdom's National Health Service, that is NHS. This may include lifting much heavier weights without a gradual build-up or running a greater distance with no training. Then coming to text C, and that's all about a particular pictorial, okay? So which is all about a study, those who have included as well as excluded from the study. A lot of numbers mentioned here, so mark all the numbers, which is very beneficial, okay, very important. So cervical spine injury from RTA 148. So likewise you can mark all the numbers which is in brackets, the signs and symbols. Okay, I'm just marking all the numbers here, okay, without even carefully reading it. I'm just marking all the numbers because it is very helpful. Yes. Okay, so these are all the numbers, which comes under inclusion and exclusion criteria. Okay. Then text D, it's all about the treatment. Treatment for, so treatment for soft tissue injuries depends on several factors, including, so that type of injuries include the severity, the type of injury, particular joint, muscle or limb affected. Okay, all the bullet points. Then people can often self-treat mild or soft tissue injuries without seeing a doctor. Then people with severe, sudden or continuous pain should speak with a healthcare professional. Likewise, if the pain does not resolve over 2 weeks or it continues to worsen, a person may benefit from a medical opinion. Medications. So what are the medications included? A doctor can recommend appropriate over-the-counter or OTC pain relievers and non-steroidal anti-inflammatories or NSAIDs. However, according to the NHS, NSAIDs might actually slow the healing process, if a person takes them too early. Therefore, a person should speak with a doctor. Then physical therapy is there, so which is to improve your mobility. Then according to 2015 research, then bracing or splinting will be there, which means stopping the injured area from moving can help prevent further damage. And torn muscles, tendons or ligaments may need surgery depending on how much of the tendon has torn and how. Yeah, something has happened in between, it's okay. How severe it is. Okay, so that's all about text D. So we are coming to this first question. Okay, so what about the first one? Any idea? Okay, so the keywords as well as your answer. So let me know in the comment, what is your answer for the first question? The first one, disparate kind of injuries may requisite the intervention of surgeries. Okay, so disparate kind of injuries, it is actually mentioned in text A, but the question is not complete yet. So we have another one, it is may requisite intervention of surgery. So this injuries are connected with surgery. So where is it mentioned? Very good. Yes, Shabna. Okay, Libby. Janita, it is from text D. Very good. Okay. So disparate kind, which means different kind of injuries. Actually, different kind of injuries which is mentioned in text A, as you know. Okay, but the question is asking you regarding it may require the intervention of surgery. Surgery is mentioned, the treatment mentioned in text D. So answer is text D. Okay, Marin. Yes, 𝐉𝐵 Yes, 𝐉𝐵 Elizabeth Basil. It is from text D. Okay, very good. Second question. Considerations that usually trigger soft tissue injury. Okay, so the keywords considerations, trigger. Any idea? What are the considerations which I can say? What are the factors? Yeah, it is a simple word. So what are the factors that usually trigger soft tissue injury? Any idea? What about second question? Okay, Shabna. It is from text B. Okay, very good. Yes, Reba. Yes, it is text B. So answer is from text B. Yes, Libby, Peter, Akku. Okay, yes, spots mentioned. Very good, dear. Yes, Janita, it is from text B. Okay, so the considerations, which means the factors that usually trigger soft tissue injury, and that is mentioned in text B. See, okay, a lot of sport activities mentioned here. Okay, so soft tissue injuries are common in sports and exercise. Clear? Then the next one is, okay, so first one is text D, second one it is B. Okay, then third one, how many people have, okay, how many people have gotten cervical spine injuries from RTA? So that keywords, how many, they need a number, how many. Then cervical spine injuries from RTA. Clear? So what is the correct answer here? That is from text C. Okay, and where is it mentioned in text C? It's all about the numbers excluded and included, right? Okay, very good. Yes, Libby. Okay, Marin, it is trigger from text B. Very good, dear. Okay, Reba, Lijo. Text C, Marin, it is text C. Libby, Peter, text C. Reba, Rijo, text C. Akku, yes, it is C. Okay, then the fourth one, the part of the body which undergoes sprains. So very easy question, right? Sprains. So where have mentioned about this part, sprains? Okay, the part of the body which undergoes sprains, yeah. Any idea? Fourth one. Okay, so that sprains mentioned here in text A, right? Is it text A? Yes. So these involve the stretching or tearing of ligaments. These commonly occur in the wrist, ankles and knees. So answer is from text A. Then fifth one, the rationale behind an ascent in the complication of sporting injury. So rationale, which means the reason. Okay, ascent, which means ascending, increasing, okay, increase. So rationale, the reason behind an increase in the complication of sporting injuries. So where they've mentioned about the sporting injuries, or there will be an increase, what are the reasons for that? Okay, sporting, it is mentioned, of course, in, yeah, it's already mentioned in text B. So, which is from text B, as you can see here, it's all about the sporting injuries and what are the reasons for that. Okay, trauma, overuse, overloading. So answer is from text B. Then, okay, Shapna, it is from text B. Very good, dear. Yes. Okay. Then sixth one, the components that ascertain the treatment pathways of soft tissue injuries. Okay, so the components ascertain, which means find out, to diagnose, identify. The treatment pathways of soft tissue injuries. So what are the keywords here? Components, ascertain, treatment. Okay. Any idea what is the correct answer here? Sixth one. Okay. So components that are certain. So which means, so that is from the sixth question, components. So what do you mean by the components? Okay, so that is from text D. It's all about the treatment. Okay, components, which means the treatment. So what are the components included? So the several factors. So in the several factors, it is connected with the treatment. So answer is from text D. Yeah. Okay, so text D, several factors, components. So that's from text D. Okay, so once again, something has happened in between. So first one, it is text D, the second one text B, third one C, fourth one A, then fifth one B, sixth one. It was from text D, and the last question, what are the pivotal functions of tendons? Important. Pivotal, which means what are the important? Okay, main. Yeah, I can say main, principal. So that is mentioned in, okay, very direct answer, tendons. So that's from text A. So answer is from text A. Okay. Yeah. So these are the answers. Clear? So now we are moving to the second set of questions, which are 18 to 14. Insufficient intake of activity prior to physical activity can increase the risk of sporting injuries. Okay, insufficient intake of which activity? So which activity? Yes, Reba, very good dear. Yes, I know that you will get 7 out of 7. Okay. Okay, Reba, it is, so answer is warm up, very good dear. So which is mentioned in text B, right? Very good, Shabna, it is from text B, warm up will be the answer. So see the third point, overuse. Inadequate warm up before physical activity can increase the risk of sporting injuries. Okay, so that is from text B, answer is warm up. Okay, so the second question, the early consumption of which prescription would make the healing process slow? Okay, so early consumption. So consumption, then prescription, which means the medicine. They're asking you which medicine. Okay, that will help for the healing. Sorry, not helping. Yeah, making a slow process of healing. So yeah, what about that one? Ninth one. Oh, a lot of correct answers. Okay. Yes, Marin, Reba, Aku, Libby, Binila, Anu, it is warm up. Very good. Yes. And what about ninth one? So which medicine they are asking you? Which prescription or which medicine? Which the early consumption? Okay, the early intake of which medicine would make tea? Any idea? 10th one. Very good, Libby. It is ligaments. Very good. So where is it mentioned? Ligaments. And that is from text A. These connects bonds to other bonds, providing stability. Very direct answer. Okay, ligaments. Yeah. So that is ligaments. Okay, Marin, very good. It's ligaments. Okay, so the next one, 11th one. What approaches can be embraced to decline the injured area from moving and thereby avoid damage? Avoid damage, which I can say to prevent the damage. Okay, so what about that one? What approaches? What approaches, of course, which means more than one, right? Yeah, plural. So answer is what approaches, what procedures can be embraced to decline the injured area from moving and thereby prevent, avoid, which means prevent the damage. Okay, Shapna, it is bracing and splinting. Okay, Binila, bracing and splinting. Okay, Reba, Rijo, it is bracing and splinting. Okay, Marin, bracing or splinting. Yeah, bracing or splinting will be the answer. Okay, so 11th one, which is bracing or splinting. So which is in text D, and where is it mentioned in text D? Yeah, so second last para, bracing or splinting, stopping the injured area from moving. Okay, so from moving can help prevent. So instead of prevention, they have mentioned avoid. Okay, so answer is bracing or splinting. Yes, then. Okay, so the 12th one, people who are, okay, Libby, yes, bracing or splinting, okay, cool, very good, correct answer, okay. Then 12th one, people who are engaged in which physical activity, sorry, not physical activity, in which activity are prone to overuse injuries. So my keywords: engaged, activity, and overuse. Any idea? Who are engaged in which activity? Okay. Answer is, see, you don't have to write that play sports there. That means the activity. Okay. So just write sports. Okay. Very good, Shapna. Yes, Anu. Answer is sports. Okay. It's not play sports. It is just sports. Okay. Because instead of sports, they have already asking you. Sorry. Instead of play, they have in the question already it is mentioned activity. So answer is just sports. Okay. And which is mentioned in text B, right? That is from text B. So where is it mentioned? Overuse. See, they can play sports from the second line. That is the answer. Okay. Yes, Minu, Sebastian, it's not play sports, dear. It is just sports. Okay, Benila, yes, sports should be the answer. Okay, then the next one. 13th one. The condition which can be defined as a continuous irritation or inflammation of a tendon. Any idea? Any idea? 13th one. Okay.